All right, my name is Lance Schneider, and I'm the president of Rounded Benefits Group. And today we're going to be talking about our MEC and our MVP products. So hopefully everybody can see my screen there. A little bit about us. We had been in the business for about 30 years in the voluntary benefits and the alternative healthcare industry space, and we've been dealing with MEC and MVP plans for about the last 15 years. We specialize in working with non-traditional clients, clients that can't qualify for traditional programs, clients that don't have the money or can't afford to contribute 50% of the cost, can't meet 50% participation, or clients that are just fed up with their high deductibles on their traditional health plans. We provide really a solution where there are no other options for employers, and we can work with groups down to as low as 2 lives. The need, we've really got a situation where a lot of companies have started up over the last 2 years, believe it or not, and companies that have been around are in a situation where they're really trying to recruit and they're really trying to hire, and they want to offer health insurance because the employees that they want to attract, the employees that they want to retain, those key employees want health insurance benefits. So they know that health insurance is necessary in order to attract and retain employees. Again, the situation that they run into is they can't meet the participation requirements. Costs prevent them from doing so. And we really got a solution. And the industries we're really talking about are anything from law firms to dental offices to manufacturing to home healthcare to staffing, hospitality, and really everything in between. All industries really are affected by this right now. And some companies have been in a situation where obviously they need to reduce costs and they're looking for a solution for an alternative health plan to what they're offering or have been offering for the last several years. So our plans are pretty easy. Okay, they are really the easy button as far as benefits go. Our plans are limited day copay driven plans, so they have no deductibles. They are the opposite of what a traditional health plan would be. Our plans have no deductibles. They have no coinsurance. They have no pre-existing condition limitations, and there is no underwriting. We have shelf rates, which I'm actually going to show you in a minute, and they are good from Florida to New York to Hawaii and everywhere in between. So the rates are universal between all states. We only require 2 lives in order to participate in the program, and we offer 8 different plans, and an employer can offer all 8 different plans if they choose to, or any combination of them. But with the 2 lives required to participate, that's whether the group has 2 employees or whether they have 2,000 employees, we don't have the 50% participation requirement. Again, the rates are unified in all states. There are downline commissions that are available on the program as well for our brokers that are on the call. So, who is the right prospect for the program? I mentioned some of the industries that we work with and some of the companies that we work with, but really anybody is a good demographic for this. It's really designed for the small group and the large group market. So we have a ton of groups that are under 50 employees. A lot of them are right around that 20 employee mark, seems to be a sweet spot, but we've got a lot of groups that are over 50 employees as well. Groups as large as 2,000 lives. Groups looking for alternative and traditional medical coverage. So any group that's saying, we're looking for an alternative to a traditional plan, we can't meet participation requirements, we can't afford to pay 50% of the cost. Our program actually requires the employer to pay 0 towards the cost of the health insurance. The employer can contribute if they choose to, and they normally do, but it is not required for them to pay anything. And really groups that are fed up with their high deductibles. I saw a group the other day that actually had a $9,000 deductible and a $16,000 max out of pocket, and they were paying $600 a month for that program. And that's a program that they needed an alternative to. Their employees couldn't afford it. They couldn't afford it. They weren't meeting 50% participation. They couldn't afford the deductibles. So groups looking for a second, more affordable option as well. So this can be offered as a dual option with other programs that may be offered in a group. So there's a lot of opportunities out there for this product. Let's talk about how our plans work. Again, there are no deductibles. Okay, I want to stress that there is no coinsurance. Okay, it is a copay driven plan. Even hospitalization has a $400 copay. Even maternity has a delivery has a $400 copay. So there are no deductibles. There's no coinsurance under the plan. It is all copay driven, and it offers 8 levels of coverage. So I'm going to go through 4 of the MEC plans, and then I'm going to go through 4 of the minimum value plans. All of these meet ACA requirements, and they will get an employer out of the A and B penalty. Okay, so also no pre-existing condition limitations, obviously with an ACA compliant plan, and there isn't underwriting. I don't even need a census in order to provide you with a quote. Okay, so the plans are very, very simple. So let's talk about the MEC plan. A lot of people have seen MEC plans. MEC plans aren't very attractive a lot of the time. They don't offer a lot of benefits. They're a wellness-only program, and that's what they do. They cover pap tests, mammograms, checkup, physical exams, baby well care, all that good stuff. Ours is a MEC plan basically on steroids, so it offers a lot more benefits and covers pretty much everything outpatient. So while it does cover all of those wellness visits that we talked about for free, it also has a $25 copay for office visits that then covers 100%. Got a $50 copay if you go to a specialist, $50 copay for urgent care, x-ray and lab, $350 copay for diagnostic. It has the free wellness care. It has unlimited telemedicine, and they pay a $10 copay for generic drugs. So there's a lot of MEC plans out there that just cover wellness. This plan is a lot richer, so it's covering everything outpatient, if you will. As you get into our MVP plans, you add in inpatient benefits. We've got 4 different levels of MVP plans. I'm showing the difference of 3 of them right here. The basic plan adds in surgery, hospitalization, allergy services, ambulance, and more. So it's going to be a traditional MVP program, meeting 60%. The plus plan is going to add in additional days of services. So it's going to add in additional doctor visits. It's going to add in additional specialist visits, additional services for all of the things that are listed, urgent care, emergency room. And it's also going to add maternity. And maternity is covered at $400. So if you have a baby, you pay a $400 copay. That's it under this plan. I like to use that as an example. And then when we go to our ultimate plan, this is more of our traditional plan with unlimited visits and days, adds in things like radiation, chemotherapy, dialysis, brand name prescriptions, even organ transplant. So this is our unlimited program. And you can kind of see, you can offer multiple levels of this coverage, and you can see how these programs work. The MEC4, again, an outpatient only plan. The basic plan, adding in hospitalization, allergy services, ambulance, home health care, all of those things. And then maternity being added in when you get to our plus plan. And then our unlimited plan obviously has no limitations on coverage at all. And it's shelf rated at $546 a single. It's actually $1,264 a family. Not sure why it says $1,400 on there. And our plans actually start with our MEC plans down to as little as $98. So they're very, very affordable programs. Okay.